Hi, I'm Dr. Robert Pruni. Welcome back. I'm with Buddy Tuggle, one of my patients, and we just sat through the interview with Pam Frazier, and Buddy and Pam are friends, so we got a little bit emotional after the last talk. But Buddy, tell me a little bit about yourself.
Well, I'm Buddy Tuggle. I have been coming to see Dr. Pruni here for about 10, 12 weeks. Back in the spring, I got knocked off of a ladder, cutting a limb out of a tree. When the tree limb came loose, it hit me and knocked me off the ladder about 10 feet and knocked the breath out of me. And I guess before that I'd been having some trouble with sciatic nerve type problems. And I'd also had 2 years ago a hip replacement from a disease that I'd had as a child, that the doctor said I would probably have to have a hip replacement when I was in my 50s, and that's what I ended up having to do. And I've gotten back a whole lot of motion. My back doesn't hurt anymore from the fall, and my hips have balanced out, and I feel a lot better.
So the hip replacement's on the
left side.
Which side did you come in here that was hurting?
My right side.
Right. So your right side improved a little bit and got a little better.
Right.
What's interesting about the left side?
Well,
can you tell us what's interesting about your left side where you had the hip replacement?
The flexibility has really better than my right side, which is amazing. It really hasn't hurt, but it's just got a lot more flexibility, more than I've ever had in my life that I can remember.
We do a little bit of rehabilitation here, do different things in the rehab portion of the office with balance. Can you tell us a little bit about that?
We work on a balance board.
So how did you start off, first of all, when we had you do the balance work?
Well, I was really bad. I mean, I could do it, but not very well. And after, I guess, about 3 to 4 sessions, I started getting the hang of it.
Right.
And now I can stand on one leg on the balance board, doesn't matter which leg, and stay balanced.
And what I also noticed the other day was the Bosu ball. You were doing that.
Yeah, started with the Bosu ball, doing that work, and gained strength, balance in my legs, strength in the agility there. Also, we've joined a fitness center, which has helped a lot too. I've lost some weight. I've gotten stronger. I've increased the weights amounts.
I noticed the weight loss.
Yeah.
We could see that immediately. If someone was having some of the same kind of problems that you were suffering with, what's the best advice that you could give them? Well,
we have suggested to several people to come to a chiropractor, such as Dr. Pruni here. And what's good about this type of practice compared to others is it's not just getting the adjustments, it's helping with the whole body, your strength, your agility to be able to move, bend over, stretch, and get those flexibilities going that a lot of people lose when they just sit there, particularly today's lifestyle, where you're at a computer or driving a car and you sitting there in traffic for hours. And even has taught little things to do that you can do while you're sitting in the car, stuck in traffic, to help release tension and get your flexibility back.
So if you're driving down Five Forks in Lilburn and you see people stop at a stoplight doing one of these things, you know that they're one of my patients.
Right. We know
or if they're
that.
doing this kind of stuff for the deep flexors in the neck.
Right.
So it might look silly, but it's helpful.
It works.
Okay, very good. I wanted to thank you, buddy, for coming in and telling everybody about what you were suffering with, and it's unique, and you've had some really good results.
Okay.
And I appreciate your time.
All right. Thank you, sir.